During CSF drainage, you can do pressure controlled drainage or volume controlled drainage with the LiquoGuard 7. When you want to do pressure controlled drainage, you choose reasonable high P set, which is the pressure you want the patient to keep. In this situation, the patient shall have a pressure of 15 millimeters of mercury. Whenever the pressure is higher than the blue line, LiquoGuard will drain to reduce the pressure. Whenever the pressure is below the blue line, the pump will not turn. So drainage is controlled because of pressure. When you want to do volume controlled drainage, you want the LiquoGuard to always drain constantly, without paying attention to the patient's pressure. Therefore, we first of all reduce the speed to not overdrain the patient. Let's say, for example, 5 milliliters per hour. Then we level P set, the blue line, to, in this example, 5 millimeters of mercury. Now LiquoGuard will constantly drain because he's unable to reach down to 5 millimeters of mercury with that low pump speed.